Hey, I look at your presentation about being professional. What was that all about?
Oh, that was just saying what I need to do to check some boxes.
You didn't do you didn't do anything. You just
No, I
sat there.
I just got up and made some nonsense up. No, I actually, sorry, this might be viewed by assessors. I put a lot of time and effort into that, and I personally reflected on professionalism and what it means to me, and I presented that in an organised manner, achieving all 5 of the intended learning outcomes to a high standard. Finished our first semester. What was that?
There goes the bloody $1,000 model. Just in there, way.
Okay, I don't think I can put this one up on YouTube.
You definitely can.
I don't think I can.
I insist. This is getting uploaded.
That was intentional.
This is getting uploaded.
That
You
was
uploaded at the same time as theirs because theirs looked really professional.
Yeah, I think where the sort of placement side of things come in handy is it reinforces the learning that you're doing in the classroom and at home by yourself. So if you see something that comes up and that's what you've been learning for the past prior weeks, it sort of reinforces that and demonstrates how it presents clinically, which I think in my mind helps me remember things better when you can, formulate a patient in your mind. And that's really useful when it comes to exams as well, because you can sort of relate the theory to how a patient presents with that problem and how it was fixed in placement. Like you got to see the GP and how they treated that or whatever they did. So yeah, I think they definitely go hand in hand, but I think I'm looking forward to getting more into the practical side of things. That's what excites me.
I suppose what we see out here is a little bit unique because we're of course doing all of our placements in rural areas. So we see not only post-COVID staff shortages and most of the other challenges that metro hospitals and GP practices find, but we then combine that with all the, I suppose, barriers to accessing good quality healthcare that come with living in a rural area. So things like, I suppose, the classic rural stoicism, as we call it. So I suppose that stereotypical older farmer who doesn't really want to admit that there's anything wrong, tries to go about saying, nah, she'll be right. It's challenging, but it's also really, really interesting the way that we can engage as healthcare professionals to try and get those sorts of people, the healthcare that they deserve. Seeing that from first year, I think is really, really cool. Because I mean, we've all grown up in the rural areas, so we've seen it from a patient perspective, but seeing what you can do as a future doctor to help improve that person's access individually. I think that's really, really cool. Pretty unique that we get to see that right from the start.
Yeah.
Are you heading up now?
Yeah. No, I'm not going out.
What phone is this? Pterygoid. Hyoid. Hyoid.
Hyoid, sphenoid, frontal, mastoid.
Oh, we have to learn all that next semester.
Lateral pterygoid plate.
Oh, those holes in the bloody thing.
Oh,
That drove me mental.
We're going to simulate.
How not to teach anatomy? Go.
Right, we're simulating some exam questions here. This is high yield content.
This is
right here,
very.
What is this? What is this?
That's a gallbladder.
Gallbladder?
Mm-hmm.
That?
Yeah.
What? No, it's the heart, mate.
No, that's a gallbladder. That's a liver. That's a pancreas.
Mate, they can't even see what you're pointing at, mate. This is horrendous filming. Get me in control. Here we go. We're taking over. Right.
All right.
Here we go. How do I zoom this thing out? How do I...
Yeah. I thought you were teaching me.
Yeah,
No.
we're teaching you
No,
anatomy.
we're taking
We
over.
don't know how. You're the one with the camera.
Hang on. Just let me... Right, we're taking over.
All right.
Young, just go sit down, mate.
Okay.
Here we go.
Left atrium, right here, right here. We're looking at the heart. We're looking at the heart, and everyone knows the heart is divided into 4 chambers. Left atrium, left ventricle, right atrium, and you can't see the right ventricle because it's been sliced off.
What are we looking at here? An X-ray or something?
This is a PET scan. This is a PET scan. Positron emission, something. As we all know, heart pumps blood. That's why we can see all these little blood vessels here. That's all blood vessels. Lots.
Oh, hang on a second.
Lots of blood. in the
Hang on,
heart.
mate. I think you're pointing at the wrong model.
Oh, sorry. Go for it.
How do you structure your day?
Completely different.
Completely different.
Than I do.
Yeah. You have a pretty good structure to you there, don't you?
My day is pretty routine. Wake up as early as I can. Let's say, wake up at 6, roll straight out of bed, straight on the computer, and pretty much, get straight on to reviewing content and doing the hard stuff first. Do that until my brain is fried like it is now.
Yeah.
And then pretty much just relax for a bit, go to the gym or do these other tasks. Yeah.
And you, Sam?
Oh, well, mine's the opposite. I mean, or not really the opposite, just very different. I try and get up as early as I can. Like typically I'm up and at it before 6. First thing I do is do my revision, do my, important study for the day. Then just once it hits about, once I've had a cup of tea, well, not a cup of coffee, no tea, no coffee, all of that. Once I've had a hot chockey and done, what I deem the important stuff, study-wise for the day, it's about 9:30, 10, and then I clock off for the day and I entertain myself for, however many hours, and then by that time I go to bed, rinse and repeat, yeah.
The concept of med school before you even start your undergrad to what you're seeing now while you go on placement and learning within the classes, have it changed?
Our perception of it.
Yeah.
I don't think our perception of the first year has changed. I
Yeah.
think mine has of how important the clinical, part of it's going to be. It's almost like a lot of the clinical stuff. The preclinical knowledge is somewhat useless, isn't it? When you sit in the GP and thinking I'm clueless. .com here, because,
Someone comes in with diabetes and you're not bloody trying to work out the physiological mechanisms behind
exactly,
it. You don't even think of it. I think that's probably everyone has learned that in this first year. We know we have to do it all for now, but everyone's kind of got the attitude of, once first year's done, then we'll get on to the actual good stuff, and then it becomes medicine. I don't know. I reckon I mentioned it in one of them.
You mentioned it,
Yeah.
like it was a last minute
I just
thing.
thought it was cool. I have no fancy answer. I just thought it was cool, and I want to do so. Maybe I don't want to do medicine. Talk to me in a year, and I'll probably change my mind. But
What will you do in a year?
I don't know, mate. I don't know. I have no clue. That's why I'm saying if you talk to me in a year, I might change my mind. But I think it's cool for now, so I'm going to keep doing it.
I feel like I thought I knew. I was the same. It's just cool. It's interesting to study. But I feel like the more you hear other people's reasons, and we went on the med retreat, and the guys were saying that he's still trying to figure out why he's doing medicine, and he's like some 60-year-old bloke. So I think part of it is you're not always going to know why. I think it's part of it's finding that reason, and I don't think you're ever going to find that reason and then be done with it. I think it's an evolving sort of thing, but who cares? You have enjoyed it.
Yeah, it doesn't matter. Some people find meaning in their work, some people don't. Some people need a purpose for stuff. Some people just do it.